Yep,
Can you hear me?
pretty well.
Yeah, you're a little muffled, but
Coming through a mask.
hi, Scott.
It is muffled. You could mute your device. You don't have an echo down in the That sounds good. Okay. We will go ahead and get started with the meeting. That is a discussion about going back to school and what's required to go back to school. Last week we had a session and we decided we needed to meet again. Dr. Moore has given us a proposal. After the proposal is briefly described, that Dr. Moore is going to do, then we're going to open it up for questions. If you do a question online, you can type it in and we will read it so that we can see it. We need you to identify yourself, whether you're here or online. And then we want to limit your comments briefly, not an expanded one, but your real question, so that we can address all the questions that are possible. Any questions from the board? How about it? My name is Barbara Erke. I'm the chair of the health board. And Dr. Bragg, would you introduce yourself?
Hi, I'm Jeff Bragg. I'm a family doctor here in town.
I'm Mighty. I'm a dentist here in town.
Chuck Bowling, I'm a businessman in town.
Phil Renfro. I am a family physician as well as public health at Indiana Wesleyan University.
Okay, so we're going to turn it over to Dr. Moore to give.
Is Dr. Miller on here?
Yes, that's it.
Oh, it's Dr. Miller. Are you on? Could you introduce yourself?
Can you hear me?
Yes.
Yes.
You want to introduce yourself?
I'm sorry, yeah. Jeff Miller, I'm a general surgeon here in town.
He's on the health board as well. I think that one more maybe will be coming in. We'll go ahead and get started. We have several people who are online and they will introduce themselves. So, Dr. Moore, I think if you sit at that table, it may be helpful to briefly describe what the purpose is, and then we will move on with what's happening.
Good evening. I'm Dr. Moore, and thank you all for being here today. We learned a week and a half ago that the state health department had deferred to the local health department to make recommendations for opening up the schools. And so with that in mind, we looked, we talked, we came together. There's a standard thing that is being done. That is people that we do cleanliness, we take care of droplets, that if somebody is found to be positive, that they isolate at home, those exported to being quarantined, and we clean it up. And to see can we find a safe way to open up the schools. And I believe that we can do it better if we add to all of that testing. The testing is imprecise. It's very precise, but it is not 100%. And being tested today is not the same as being that you won't get it in a day or a week. The state did a program with the health department at IU, and about 1% background positives are in Grant County. So that if we have 100 kids who test negative today, that the likelihood that 2 months from now, there's going to be a big outbreak among those kids is relatively small. So that while it isn't perfect, it is very good information. The quality of the test are by emergency use authorization as opposed to having 2 years of data behind it, but they reach a high level, probably over 90%. Even the gentle tests that we do, as I talk with the hospital and LabCorp, are very good. So that we're using information, and that data is like a Clemson football team is not going to start because everybody got there and they found out that 28 of their staff are positive. And we're looking to see, can we know before school starts what's going on so that we can assure the parents what is the status that happens with that. In 3 layers, we're recommending 1, 2, 3, 4. The first one is that all of the people that are hired by the school, hired or volunteered by the school, but they're on staff of the school, are tested for COVID at least 3 weeks before school starts. That those who are found to be positive isolate for 10 days with the last 72 days, last 72 hours without fever and without symptoms. Those who are exposed to them are quarantined for 10 days, but I recommend that they be tested as soon as they learn that they're exposed, and that they're tested again 6 days later. If both of those tests are negative, we presume that they have not been infected by that contact, and they're allowed back into into the stream of what's going on with it. And if those who are found to be positive, while we require those who are hired be tested, those that are in their environment, in their home or their partner, we recommend that they be tested for COVID, because that index person got it from somewhere. And there's about a 30% chance that if you live with someone who has COVID, that you're going to test positive for antibodies and maybe for the virus also. So that we look not just forward with quarantine, but we look backward to find out where did that infection come. And the idea with this is that the kids are not likely going to get very ill, but their parents and their grandparents will get ill. And we shut the country down. And when we shut the country down, we stopped the propagation and we slowed it down. When we started opening it back up again, an important vector, I believe, is the kids interacting with one another and then bringing it home to their kids. So we want to find a way to do that. First, by welcoming them into a safe environment by testing. The next level that we're recommending is those kids who are involved in high-risk activities where they're going to be expiring. This is spread by droplets, not by bugs or any of the other things, primarily by droplet spread. That those who are in high-risk activities, those who are in sports and in the performing arts are an example of those, that those be tested before school starts, at least 3 weeks before school starts, in order to go through that same scenario that we find out where the positives are, and we have a chance to control them so that we know what's going on with it. And this testing is available at Optum, being paid for by the state. As of a week ago, the governor said anybody in the state of Indiana who wants to be tested can be tested. You can be tested repeated times if you choose to be, just as long as your test results have come back in. So there is no longer, like it was at the beginning of this pandemic, a shortage of testing supplies, and being tested does not take away from the hospital's ability to treat acutely ill persons. So that's our second level, is those who are kids who are going to be at high risk activities. The basis of this is that all kids, this year is an exception, all kids who are involved in sports are required to have a physical. And because we feel like that's good for them and good for the school. And in this once in a lifetime pandemic, I think that the new normal is that we need to know what's going on when we say that this is a safe environment to come. All kids are required to have an immunization unless they have it. And again, in this pandemic, requiring this does not, to me, seem to be an unreasonable thing to have. Level 3 becomes more difficult to do, and that is that we recommend that all kids who go to school under the age, up to the age of 12 and over, be tested for COVID. And because the recommendation is, as we said, that social distancing, wearing a mask, that the likelihood, the reality of kids doing that in a way that's going to minimize the spread is very low. And our ability to say to a parent, these 20 kids that your child is going on the bus with, they've all been tested, and we know to a 90+% certainty that all of the kids that are on the bus with those kids are COVID free. So that we recommend that they be tested, and there's gentle tests that are available that we can make available. That makes this a non-onerous thing and offered by the state and not at expense to the others. The fourth level of testing is more challenging, and that is that all kids, regardless of the age, are tested, so that when we invite a kid in, the kids to school, that we know that they're there, and that we want them to social distance, we want them to wear a mask, but when they don't, that they're doing it in an environment that, as much as we can tell, is a safe environment to do. The tests that are available, the earlier ones were very uncomfortable. They went way back to the back of the nasal passage. I checked today with LabCorp and with Marion General Hospital, and the the accuracy of that test is an acceptable level with the other tests that are done. There have not been head-to-head tests with them. If it's a high-risk population, the positives are going to be more accurate. If it's low risk, it could be inaccurate. If it's tested too early, they got exposed this morning, and tonight we're going to test them. It will be off. If we wait too late in the disease process, it'll be inaccurate. But outside of that, the test results are very accurate. And when we say that we are welcoming the kids back into a safe environment, that we've done everything that we can. What if somebody shows up positive in the schools? That we do that same thing, that we test them. If they're positive, they're isolated for the 10 days, being symptom-free, that the people that they're exposed to are quarantined and tested, but that if they, for example, are on the football team, that all of the members of the football team, we know their baseline, but all the members of the football team are retested. If we find them negative now and negative 6 days later, they did not contract COVID from contact with that index person. And then all of the cohorts that are part of that football team that are going on the bus or are practicing with him are also tested. We know their baseline, we know where it came from. If we find positives that are there, we then go backwards to find out in their environment. We recommend but not require that their environment be tested. And that way we know what's going on in the community. We have the highest likelihood of stopping this from spreading to parents, to the grandparents, where the death rate is going to occur. And we continue with that to maintain a safe environment for that. And I will now yield back.
Thank you very much, Dr. Moore. I see that there's a question up here on the board that students are not required to have a new physical for this school year. And that in the state of Indiana and IHSA has made the call to allow for last year's physical as well. That's a bit worrisome, but especially if we have students who have had other health issues throughout the year that the last year's physical. But so they won't be all required to have a physical this year, but there is that possibility of still doing COVID testing. So that was the great, that was, for many of you, you have had the documents in front of you. You have the documents online, I believe. If you're missing them online, if you could make a note, we'll try to get you them online. So I would like to entertain, this is a recommendation coming from Dr. Moore. I'd like to entertain a motion and a second to get it on the table so that we can have discussion. So
I move that we accept this discussion.
I'll second it.
Okay, so motion made and seconded and now it is on the floor for people to offer questions, thoughts, comments, and people are okay. Who are
My name is Tab McKenzie. I'm the superintendent with Mississinawa Community Schools. I have several questions, so I don't know if there's a limit that we get to ask or what. My first question is, how many other counties in the state of Indiana are making a similar recommendation?
It came down from the state that we do this, and I did this. I haven't checked to see what others are doing. It was what I felt as this health officer of Grant County that we do that. So I don't know what other counties are doing.
Well, I want my questions not to sound like I've got a bias against testing, because I don't. My personal choice would be that everybody is required to wear a mask when they're in public and are going to be possibly around other people that do not live in their home. I also would require social distancing when in public, but that I don't get to make the rules. So my questions really are not from my personal perspective, but from my perspective as a superintendent of schools in Grant County. Is this a requirement or a recommendation by the Board of Health?
The Board of Health the board will make that decision. There's been two that have been there. The one is that if this is the way it should be done, then this is the way it should be done. The other, if it's a recommendation, have we as a health board made a statement that really goes to the best of assuring the health of that. But I, as a health officer, put this forth, and I asked the board for if we would say as a body that this is a recommendation that people can or cannot do, or if they say, like we say with the health physical, and it's not being done this year, it's the concept that the school system can say to a child that if you're going to play sports, for example, that you need to have a physical. This year, COVID made an exception, but the concept is still there. If you're going to do it, that the school has a right to say you require a physical. The school has a right to say if you're going to bring your child into the system, you have that. So even though that's different, the school does have that. And I preface it by saying this is once in a lifetime. None of us who are here have ever seen anything that this virus has killed more people since in the last 3 or 4 months than were killed in all of the wars since there. And that this is something we're meeting for the first time, and the health board has the responsibility for saying, how can we do this safe? How can we, from a health point of view, open up our school safely and assure the parents that we're doing that, knowing that not everybody is going to be happy with a physical or an immunization or a COVID test.
So I think what I'm hearing is that a recommendation or a mandate. And I think that that's a great discussion. It would take a lot less time if it became a recommendation, because then people can do what they want. But if we have a mandate, it's going to take, it takes a lot of conversation. So having a recommendation, in my opinion, really takes, you do pretty easy. We recommend these things. If it becomes a mandate, that's going to take a longer time to decide that. So I don't know if we need to stop at this point to decide if we're doing a recommendation or a mandate.
And I would recommend that we discuss it further, and that is the weight of it. That is the weighty part. If we just simply kind of make a wish list that we as a health department say, that's an easy thing to do. But if we say we're going to provide, and I'm not necessarily saying that we have to do this. I'm presenting it for discussion. But if we're going to provide leadership, sometimes we might have to make a difficult stand and a difficult position if we feel, as the advisors for health in the community, that that's what we would advise.
I really wish the governor would have stepped up and provided that leadership. If this is so imperative, why didn't the governor require this? Why didn't the State Board of Education require this? Why would Grant County stand alone? And we don't have evidence that the other 90 plus counties are going to step out and take this step.
The State Department of Health.
The governor hadn't taken this step. The state board hadn't taken this step, and probably a lot of other counties are not going to take this step. I agree that it's the safest thing to do, but so is mask. And so far, the Board of Health hasn't required masks to be worn inside the school. Why wouldn't you do that? Make that recommendation or requirement as well. My other question is, if this is going to be a requirement, who's enforcing it? The Board of Health or the school? I think if the Board of Health is going to make this a requirement, they should own it and enforce it with the families, and not expect the schools to do that.
Thank you for your comments. I'd like to hear from the board their thoughts about requirement of mandate. And I would agree with you that we do not know why the state health department said for this very first time last week that now it was our responsibility. So we are feeling the burden of what this responsibility is for the health of the population of Grant County and the school. So we are feeling that burden. So I would like to open it up to find out what people want to do, a recommendation or a mandate.
I think one issue we need to address immediately is how do we handle students who aren't tested? If we make it a recommendation or a mandate, what are we going to do about the students that aren't tested either because their parents decline or Yeah, I mean, there's gonna be a million reasons why kids can't be tested. What would be the plan there?
And so, go ahead.
Okay, thank you. So that's a great question. Any other questions that we want to pose?
How long will it take you to test back?
1 to 2 days.
Okay. Dr. Wright?
I think that the medicine side of it is solid. Based on what we know now, these are the appropriate thing to do. My concern is the ability to implement the recommendation, recommendation. So from my standpoint, I feel like it has to be a general recommendation that we're trying to fill in the gap of where the State Department of Health did not give us direction, and we're trying to give best based on the information we have now. In my opinion.
Okay. Recommendation?
I guess for myself, this is Dr. Renfro. One of the questions I have, Dr. Moore, you have these different 4 levels, and I realize that they all represent various options. I don't know of those 4 options, which ones do you think are more, and it does tie in with what Dr. Brad said, is the issue of implementation, which I would assume that as you start with 1 and then go to 2 and 3, the level of implementation becomes much more difficult. Certainly, the comment that is made, the question that was made about this mandate versus recommendation, then you get into the areas of issues of enforcement. Who's going to enforce that? I would like to respond to our superintendent's comments that I was looking at the CDC website specifically for a recommendation for schools myself. They are recommending masks. One of the challenges, particularly when you're dealing with younger grades, I think most of us in this room would recognize that the idea of the young children are going to wear a mask in school is not really a realistic expectation. There's too many barriers that I would anticipate with that. My own wife teaches in one of the local public schools. Just getting children to sit in their chairs still can be quite a challenge. Much less challenge they have to wear a mask. So that's one of the concerns about that particular approach. And I guess as I look over this, I don't want it to sound like I'm rambling here, but I'm just trying to process this. Is that it would be nice to hear from Dr. Moore, which of these levels you think are feasible or practical that can be implemented. And then I think number 2 is in response to the question about why we're doing this and the other counties aren't. I don't think that we are bound by what the other counties are doing, because our desire is that we would actually use our best knowledge and evidence in order to get ahead of this. My observation, both as a doctor and as one who teaches public health, that up until very recently, most of what we have been doing in this country has been reactive instead of proactive. In other words, we are responding to an infection. I like to use the analogy, it's like trying to shut the door of the barn after the horse has already gotten out. So what we're trying to do here is to find out which horse is trying to get out and close the door before they get out. And that's why I think there is some value in this particular proposal. I still am uncertain in my mind which level it's going to do, considering practicality, enforcement, support. I recognize that there will be people in the public who will not appreciate these efforts, but I do think it is a proactive approach to try to get ahead of this infection instead of waiting until October when we've got to close all the schools because, again, we just did not anticipate what was going to happen.
Thank you, Dr. Renfro. Anybody else? Yeah.
Chad Lighty. I think I'm kind of leaning towards, as I look at it with my own dental practice, I would tend to say for the superintendents, I would lean towards requiring your staff, your employees to be tested, and the board could highly recommend children being tested. There's a difference there. And I would go so far as to say the same thing with the mask wearing. I would tend to say, I would require my employees to wear masks and try to social distance, as much as they can, as the example. And I would also recommend that children also, especially the older children, wear masks. Because it's going to be very difficult, as you said, to police this, but you certainly can police your employees.
Mentioning the employees, there's a question. Have you checked with the Equal Employment Opportunity Commission? Have you checked with the Indiana State Health Commission?
So this has come up, is that for me? I'm sorry.
Well, that's
Okay.
a question up there from Brent Garrett. And Brent Garrett, identify yourself. Are you a superintendent?
Yes.
Okay, I thought he was. Okay.
Superintendent of Eastbrook Community Schools, and I checked with our school board attorney. We're the only inquiry in the state of Indiana, and they cover all districts throughout the state for this question. So she wanted me to ask, have you asked the Equal Employment Opportunity Commission, gotten guidance from them? How are you going to handle employee concerns? Who's going to handle the liability if there's a suit presented? She also mentioned that the Indiana State Health Commissioner, Dr. Christina Box, has now said that even checking students or staff every day is impractical. So she's rejecting the concept of temperature checks daily. I just don't see how this plan is feasible. I talked with Dr. Moore this morning. I believe he has a good intent with this. I just don't think it's practical. What happens 3 weeks before school, a day later, they go somewhere and contract it, then our data is false. So it's just a starting point. There's so many factors involved with this. I have grave concerns about this concept. If you want to recommend it, you can recommend it. I would challenge the requirement of this for all schools in Grant County.
So what was your question about the legal personnel?
Well, someone suggested that we require all employees to be tested. I think we're infringing on their rights as employees, and we're the employer, but I still think we'd be infringing on their rights if we'd mandate that, since it's not a state law.
Would you like to answer that, Dr. Moore?
Yeah, and again, in my answers, I don't want to imply that I do not appreciate the superintendents being here and giving input. The reason for us not just simply doing a mandate last week, but coming together is that we want you involved in hearing and understanding, and we want to hear back from you about all of these. So my answer is not because I don't appreciate what you're saying. Our attorney did look into this as it related to us, because one of the things that we did as a county is said that everybody who comes in this building, we want to know what your status is, so that everybody had to be tested in order to work here. And that our attorney felt that was a right that an employer has, that the employees know if they have a communicable disease when they come in. The information must be handled delicately, but they have. In terms of lawsuits that may come about, I don't know. I'm trying to conceive of what lawsuit might come, because you say that if you're going to work here, you have to certify that you don't have a communicable disease if you're going to be working with kids. There may be a law, but our attorney didn't ask about schools, but about the concept of, can an employer require to be there? In terms of because somebody could leave here and get infected with COVID, that we don't test them, is again, the background positivity in our county that the state had is about 1%. So that the likelihood that 100% of the people that are tested today at the end of a month or 2 weeks are going to have any significant infections from that is small. That we have I gave you the example of the football team that reported, and they couldn't start their season because they did not test until the season started, and now their season is put back because they have to go through all of that. That until you test, you don't know. 45% of the people, again in that same state, in that same state study that was done at the beginning of at the end of spring, that 45% of the people who tested positive had no symptoms. That you don't necessarily have a fever if you have COVID. You don't necessarily have symptoms if you have COVID, but that doesn't mean that they won't spread it to mom and then mom will take it to grandmother. Those are the people who die. And if we're doing this for anybody, we're doing it not for the ones who are there. We're doing it at school because they're going to be okay. It's because they have a communicable disease that can and has in the past really ravaged our community. And so that as a health department, what kinds of things do we recommend for that? And with,
I think it's the asymptomatic people that we are most worried about. That's what we've seen has caused the issue here in locally. So anybody else on the health board? Dr. Wilson, do you want to?
I don't have anything to add.
Okay.
I do have some concerns and wonder if any of you as superintendents have discussed with some of your high-risk staff members what their wishes would be in terms of their own safety. Because I guarantee you all employ people who fall in that risk category. My name's Denise Pearson, by the way.
And I've been calling Dr. Miller, Dr. Wilson, and I apologize. Anybody else about, okay, so do we decide that if it's going to be a recommendation or a mandate? Is that something important that we decide before we really get into?
I'd like to go through it. I'd like to go through it and through it all and then come back to that as one of the latter questions for me if I could.
Okay.
I will say legal counsel recommends that you start with a self-recommendation and maybe require a mandate. That's it.
Okay. So strong recommendation. And this policy doesn't say anything about masks or about social distancing. Is that something else besides testing?
Yeah, this comes on top of what the state has, which is social distancing, mask, cleaning surfaces, testing people who are found positive. That's what in the state health department in their discussion with the Department of Education and what I understand that they gave to the superintendent. And I'm saying that I feel that we can go beyond that if we add to that, not in place of, but if we add to that testing, and if we accept the reality that kids, especially the younger ones, will not social distance, that they will not likely wear a mask, but there will be, if we don't know that there will be viruses that are in that environment that they're going to pick up, and that we can make it increasingly safe by those things that we do. Dr. Renfro asked, what are the levels that we do? I think that it's reasonable to say that if I'm going to give you a paycheck, you have to, with a simple test that you do or that you do or do not have a communicable disease that can kill people. The athletes who, and I gave the example of the physical to say that there may be requirements beyond the ordinary that you ask one to do if you're gonna be as part of the school involved in a place where the respiratory droplets go out. That is in sports and in the performing arts. And so that's level 1 and level 2. When we get down to level 3, that becomes increasingly more difficult to do. And we may find that while it may be a great idea, it just simply is not something that we can implement to do. And I am prepared. I present this because I think that we can make our school safer, but I present it not as something that I'm committed to no matter what, something that I want, if we implement it, I want us to implement it because from a medical point of view and from an educational and societal point of view, that it's something that makes sense and something that we agree that we'd like to do for our schools. And to ensure, for me, it's ensuring the mother who has her kid go on that bus, that those other 20 kids are safe because they're not going to distance and they're not going to wear a mask. And we could know what that environment is like for that mother's child.
Alan Beck, do you have a comment?
Yeah, again, this is Alan Beck. I'm a member of the Marion Community School Board. I'm not here to speak on behalf of the board, but I am here to speak as a board member. I do like the idea of having mandatory testing for staff. I feel like that's completely reasonable for an employee or employer to ask that of their employees, especially under this time. I am not as big a favor of having all the kids tested and making that mandatory. What I would suggest would be to go to a high recommendation to have testing done on kids or kids in sports. The problem we have, especially at Marion Community Schools, is if you require, let's say, athletes to have this done, you're going to get a large percentage that would just are not going to do it. And if that disqualifies them from being part of that, I just feel like we're going to unfortunately penalize a lot of the more impoverished portions of our community, which I think we need to be careful of. So maybe setting up stuff that someone could come into sports at the practices and test kids there that have permission slips or things like that, and making it very easy for them. But I don't like the mandatory other than the idea for staff. Thanks, you guys. I appreciate your time.
Thanks, Alan. Are there any other people that would like to make a comment that's in the audience?
I would. I'm here as a parent, actually.
Okay.
My name's Rob Dawson.
You want to come up and maybe speak into that mic so people can hear you?
Sure. I'm here as a parent. I have children who attend Mississinewa Community Schools. As I heard about this, I was intrigued by the testing. I really don't have as much comment about testing other than our kids are still exposed out in the community every day. So I'm not sure that it's realistic. But I value your interest in protecting our children. I think it would be better, or I'd like to see this group be more explicit about recommending or requiring masks in schools. As kids, I have high schoolers who feel pressured, peer pressure, and if kids feel peer pressure of, I don't want to look silly wearing a mask, but if there's a larger group that says masks are required, I think that gives them a little bit of backup as kids in the school system. So that would be my recommendation or my request, that you consider giving some type of mandate to help protect those kids. Thank you.
Okay, thank you.
Thank you.
Anybody else?
Question for the superintendents. What were your intentions, or what did you get from the state as far as what you think you want to do with the mask, social distancing, classrooms? Can you give us some indication of what you're looking at?
We'll call on Tab for McKinsey. Any question?
I think I heard most of it. I got the part about social distancing and mask and what the board could do to help us with that.
What are you thinking about, and what has the State Board of Education suggested to you, and what were your plans for masks and what you were going to do before school started?
Our recommendation was going to be commensurate with CDC guidelines and DOE guidelines when it comes to masks. We were going to recommend it. We were going to encourage it. We were going to try to build a culture where it was acceptable, but not just because the parent that spoke is from Mississinewa, but I highly agree with his point. I think there's going to be just observing people in our community and in our county when I go out in public. I think the overwhelming culture right now is a majority of people do not see the importance of putting a mask on when they're in public and around people that they do not live with. And so I think that culture and that value system will be carried into the school. And I think it will be very hard to enforce the use of masks throughout the day with older students unless it's required from somewhere. I think we've got a lot of, and then it comes down to how do you enforce that? What is going to be your steps to enforce that if that's required, let's say by the Board of Health? And so we start calling these parents of students that refuse to keep their mask on. And are we going to give them consequences for that? And then those same parents that we call, a number of them tell us over the phone that they don't believe in this whole thing. They think a lot of this whole idea of COVID-19 being a pandemic and a real threat to lives and health is something that's been blown out of proportion. So how do you work with those kind of parents, and nobody can sitting here listening to this conversation can deny that a number of those parents exist in our communities. And so how are we going to work with those families and those parents to get those kids to comply with a mask requirement? So our approach was going to be just to constantly talk about it, encourage it, and encourage our staff to wear it as much as is practical and possible. I think in all fairness to our staff, if I was teaching 6 hours a day in front of students, it would be hard for me to keep that mask on all day, I can tell you. It makes my face hot. It makes the area around my mouth sweat and perspire. It becomes uncomfortable around my ears if I have it on an extended period of time. And then let's go to kids that are 3, 4, 5, 6, 7 years old and talk about keeping a mask on those little people all day for 7.5 hours. And what are we going to do with the kid that says, I lost it, I can't find it, I forgot it? And we hear that over and over. At what point are we going to start giving detentions? Are we going to start putting them in school detention? Are we going to start suspending them from school? Are those the battles we want? So our approach is going to be, unless a higher force than Mississinawa Schools and our school board says it's required, we are going to recommend masks as much as is possible and encourage that. And then we're going to structure places around the school to try to create a context where people are encouraged to maintain physical distancing. We are talking about creating aisles in the hallways, going one direction, and encouraging single file movement along those aisles, where on the right side going forward, against the wall will be an aisle, and the aisle will be the width where somebody could comfortably walk single file along both hallways against the wall on both sides, and going one direction on that aisleway.
You've got a couple questions coming in.
Cafeteria, the same thing, spacing. We're going to encourage that. We're going to encourage spacing at arrival and dismissal, so on. But we're going to do the best we can. But if the governor is going to allow all students to come to school all at the same time, then all we can do is do our best when it comes to physical distancing.
Okay, thank you very much. We have a couple questions. Alan Beck says Marion Community Schools has a task force that's currently working through the ideas and options as we get closer to the beginning of August. Very little is set because things seem to be changing so rapidly across the country, mostly looking at options at this time. Samantha Euler says, while unfortunate things like sports and performing arts can be tabled until the pandemic is over, I don't think that's happening, by the way. But things like school lunches can't, and you can't exactly make masks students wear masks in between bites of food. How do you recommend schools handle high traffic mask-free scenarios in like lunchtime? I'd like to ask Brent, I know Brent, Garrett if he'd like to say something at this time.
Sure. So thank you again. We have been meeting actually since early April with the administrators and what the fall might look like. And as more information comes in, we have developed a committee of teachers and our technology team and our healthcare nurse and talking through our plans for starting up in the fall. And we're doing a lot of the same things that Tab has mentioned. Our superintendents within Grant County, we've been collaborating as well weekly about what our plans may look like, because we want to do the right thing for boys and girls, but we also want to have a sustainable plan. And so we're talking about, the distancing portion, recommending masks for students and staff, all those things we support. We're following the guidelines of in-class put out by the DOE, the CDC guidelines. We're looking for opportunities to reduce the gatherings, whether it be, getting off the buses and coming into the school and in different scenarios, spreading out our lunchrooms, cafeterias, looking in the classroom. We're talking the specifics about even how students sit in the classrooms, having them all facing one way, so that would slow down the potential spread of diseases, not just COVID, but the common cold and flu-like symptoms. So we're doing all those things that's being recommended. And I feel like we're on the front end of that, but we're continuing to have an evolving plan, if that makes sense.
Okay, thank you.
You bet. Thank you.
In response to teaching with a mask on, I did 3 hours this morning with my mask on. So, in teaching, so it is doable. It's not always comfortable, granted. The hardest thing is figuring out how to take a sip of water so your throat doesn't go dry, but even that's doable. So I do think that, we are experiencing many of these things. Other comments or questions, ideas? Yes, Dr. Gray, I don't think these mics are working, so you might want to.
Okay. I just had a question for the superintendents. Is there any plan to not have fall sports or fall sports to get started? Or are we, the plan currently is to proceed with the schedule as per usual?
Okay, so the question is, are fall sports going to happen as per usual, or have you got something different about fall sports?
I'll go ahead and answer that. My name is Dr. Scott Dietz, Superintendent, Madison Grant United School Corporation. Just like schools, our athletic programs for each school corporation must submit a designed athletic reentry program. And so through the guidance of the ISHAA in conjunction with the IDOE, many of those items have already been planned out as far as teammates getting together, conduct or contact during practice, such as football, volleyball, as well as cross country, knowing that contact between students is unavoidable in these sports. The ISHAA as well as the IDOE have given permission for sports and school corporations to reopen July 1 with practices beginning July the 6th. And so we have been working closely the past 3 weeks on those reentry plans, much in the same way that Tab and Brett have been demonstrating to you that we've been rethinking school across the board, from the time you get onto the bus to the time you get back on the bus in the evening to go home. A couple of things that I would like to bring up, some special considerations. We know teaching or talking with masks on for hours at a time can be mildly uncomfortable, but we also have to consider our audience. Teaching with a mask on is fine if you have a general education population, but many of our special individualized needs that are spread throughout our classes within our public schools, masks are an inappropriate way, because you are covering up your mouth, you're covering up many of your nonverbal communication pieces that go through in communicating appropriately to students across the board, and that's day in and day out. Additionally, many of our school corporations in Grant County have also taken the additional step to create an entire secondary school program, K through 12, that is virtual for those families who are uncomfortable with it, sending their kids into the traditional in-person option. And so we are working tirelessly to create that additional curriculum, creating that additional technology infrastructure, as well as providing the devices and the know-how to be able to teach and learn with those devices as well, to provide our families with those options. So, but to get back to the original question, as far as sports, yes, sports are given the green light by the governor's office, IHHAA, and the IDOE to move forward. And so we have rethought how practices and games and locker rooms are all done.
To what Dr. Dietz just stated, it'll be a quick one, I promise. I know that statewide, the athletic directors have been in correspondence with each other weekly in Zoom meetings across the state, and they are acting pretty much on the direction of state organizations, principally the IHSAA and the DOE, for their reopening plan for athletics. And my point is that I feel like Grant County should do the same as what the ADs have been doing. We should be acting based on state recommendations made by state agencies with regard to whether it be masks, which I've already indicated my personal choice is that I would require masks anytime a person's in public. But we should follow the concept of recommendations that's being made by the state agencies and not go out on our own by ourselves as a county.
Okay, may I just interrupt there for a moment? We are following what the state agency told us to do. They told us to make recommendations. So we are following.
I understand that, but they haven't said to require what you're talking about when it comes to testing or masks. They haven't said it's a requirement, that it's the law. They have not said that.
They have asked us to develop something for the Grant County school system. Now, we didn't ask for it, but we were told that this is part of, they gave us the authority to do that. And so we're uncomfortable doing it, but we believe that because Indiana Department of Health told us we were required to do it and to help the school system. That is our role. It wasn't that we asked for it. It was kind of a shock to all of us, but that's why we're coming forward. And we have a comment here. If you want to come up here. If you get a little closer to this mic.
I'm Sue Nicholson. I'm from Marion Community Schools. I'm the lead school nurse. Couple comments I have or questions I would have. The CDC in class, DOE, and Department of Health have a lot of guidelines, and they're pretty difficult to figure them all out. But some of the things in the in-class are pretty spelled out, and I think are very helpful. I think the superintendent.
What in classes? I have no idea.
It's from the Department of Ed and the Indiana Department of Health, and it pretty much spells out what you do in certain situations. COVID positive, COVID symptoms that aren't positive, how many hours and how many days. It's a good guideline for us. The ISHAA has listed a lot of guidelines spelled out by the state. So I think if we follow those guidelines, it'll be good. One thing I did want to let you know is physicals are not required, but there's a page of updates from last year to this year. So students have to fill out a form. So if something's changed in their health, they will get that knowledge to the athletic trainers. So there is an update of sort. It's not a full physical, but it's history of any changes in their health.
You send that in-class report to Dr. Moore, please, because we've not seen that, and that certainly could help us direct us.
Sure.
When we were told to do this, it didn't seem like there was already plans being made for things to come out of the blue, they needing to do this. So that would help Dr. Moore, that would help the board.
Sure.
Thank you. Thank you.
There were two things that the state could have done and that state health department could have done. They could have said, here's the guidelines that you're going to follow. And we would have, as a health department, done that. Or they said to the local health departments, you look at this, these are our suggestions and our other things, but you look at that and you make these and you provide that for your county. And so that they didn't say to us, simply rubber stamp this and move it on. They asked us to give our best medical judgment, and that's the job of the health board to do that. And it was a shock to us. And if the state had said, we're going to take this on, we would have gladly passed on this.
Amen. Be here this evening if the state health department had done their decision. So you've heard all the you've heard the comments pretty much, and there's a motion before us. And are there any amendments, or what would you like to do with this motion now that we have heard from everybody? We can amend it, we can reject it, we can approve it as is. And we're not here for setting how this is going to take place. Ours is going to be an overarching policy if we decide on something, and then the health department staff will make the decisions about how this is going to happen. We don't do procedures, we do policy. So that's it. Dr. Renfro, all
right. This is Dr. Renfro again. One comment as well as one question. My understanding when I have read the state laws when it comes to public health matters, that in the event of an infectious epidemic, that the county health officer has the authority legally to do whatever is necessary in order to control an epidemic. Now, that is a great responsibility, and I know that Dr. Moore carries that very carefully.
Yeah, are you able to hear Dr. Renfro?
Okay.
Miller? Okay, go on.
So,
sorry.
State law does give him the authority to act in the event of an outbreak. There is, I've read that for myself. If we take the position that this is just a recommendation, and I recognize and I've heard the voices of so many people, and I understand the many obstacles that are pressing with this, but if the situation should deteriorate, I think it would be good I appreciate the participation of all of our superintendents, if they are prepared, if Dr. Moore has to exercise his authority by state law as a county health officer to address whatever issue may arise at that point. I would certainly hope that they would support us, support Dr. Moore and the health board at that point, lest we see a tremendous increase in mortality among the citizens here in Grant County. So that's my comment. My question is, Dr. Moore, in light of what you're hearing from the superintendents, the public comments, and recognizing the authority that you have as a county health officer, what are your thoughts about this being a recommendation versus a mandate? And if you think it's a mandate, at what level would you want it to be mandated?
So, thank you. In terms of how do you enforce this, the thing is logistically enforceable. Whether it's legal to do or not is a question that I think that would, if we do have any mandate, that is pending legal opinion. The level one, that if you're employed by the school system, that you're required to demonstrate that you don't have a communicable disease. That level two, if you're going to be involved in activities where you can spread infections to one kid who's going to take it home to his mother, that you do that. That is sports and performing arts, that they are tested. That we recommend strongly, that as I'm hearing, that we recommend strongly that all students be tested, and that the logistics of how we do this has been considered, and in my opinion is doable. That again, it's not the job of the board to set that, how do we, but to set the policy for it. But I think that those are doable. But I think that the doability of level 3 and level 4, that is all students and all students above the age of 12 and all students within it, regardless of their age, be done. I would suggest that we make that a strong recommendation for that.
So I want to make sure I'm clear on this. So if I'm hearing you correctly, you're subject to legal counsel. You're recommending a mandate for level 1, which would be all the staff.
Yes.
Subject to approval of legal counsel, you're recommending a mandate for all people who are involved in athletics, group activities.
Yes.
And then for the others, it would be a strong recommendation. Is that what you are?
Yes.
All right.
Correct.
If I understand you correctly, then I would like to amend this proposal or amend our original motion with that language. Subject to legal counsel, the mandate of level 1, level 2, recommendations for level 3 and level 4.
I so move.
Okay, there's a second. Other discussion on the amendment to level 1, at least so it would read, at least 3 weeks before the beginning of school, testing the presence of COVID virus of all school personnel, paid or volunteer. Then the last sentence there is more how it's going to happen if you get tested positive.
Right.
So you're really saying that first sentence, and said the level 2 students who by nature of their activities are at increased risk of spreading can be tested prior to school. So those two are really what
What
you're
we're listing as a mandate.
as a mandate.
Subject to legal counsel.
Okay.
I think I would like to see more of a
So I'm wondering if we need to approve this amendment before we go on to something else. So we have a motion and a second to make mandates of level 1 and level 2.
Are you gonna have a comments for that, or we?
Yeah, there's comments for that first, and then there'll be a vote. Any comments on those 2 mandates?
This is Jeff Gregg. My
Use the mic for you.
my concern. The athletic fields are going to be open July 1st.
6th.
Practice.
Practice is on the 6th.
They're allowing workouts starting the 1st.
Okay.
Yeah. So we're inside the 3-week time frame for that. So it doesn't fit with what's already enacted by the IHSAA and the different school corporations. So it seems as though we're setting that up for failure if we make that a mandate.
Well, it says students who by the nature of their activities are at increased risk for contracting or spreading the virus be tested prior to the beginning of school. So technically the beginning of school isn't until August.
And we can amend that. We could amend the wording of that.
Yeah.
If that's so.
That technically they could be doing practice, but before they actually started class. The way I'm reading it is prior to the beginning of school, and each school corporation has a different start date. So therefore it would be a different time. It wouldn't be by when practice started, according to what this motion is. It doesn't say 3 weeks before practice begins.
Yeah, but how would you protect football players?
I think one response is, again, the testing is imperfect. This is Dr. Renfro again. But the point of the testing is it is a snapshot of what your incidence is of infection at that point in time. So it would be very interesting, since you mentioned athletics, yes, they may start practicing before. If you suddenly find out that just before school starts, that most of the team are infected, even if they've already infected each other, basically what you're saying is that team is out for the season, or at least for a good share of the season. So you're not testing them from a preventive standpoint at that point, but also the team is also a part of a larger population, which is the whole school body. So by testing the team at that point before school starts, you're identifying a significant group of people who potentially could infect the larger school population.
Alan Beck says, I would not be in support of a mandate to any other than level 1. So that, I mean, that's a public comment I wanted to read.
Should we?
I have a question.
Okay, Dr. Pearson?
Yes, so all of you superintendents have referenced the recommendations that have come from SHAA. I actually did pull up the document on my phone here, and it's way too long to read in this context, but is there any recommendation in there for testing or repeated testing for athletes during the athletic season? Because we're then mixing kids from other communities in a way that they very easily can transmit disease. And it seems to me like, at least in that population, there should not be just a recommendation for testing at the beginning of the season, but since we're mixing kids from different communities that have much different infection rates than Grant County, that it would make sense to test at some interval throughout the season. Is there any recommendation in those documents that you already have in front of you for testing of athletes?
I see somebody shaking their head over here that's not.
I don't think so. They, basically from what I've read through, and I've read through, it's symptomatic.
It's symptomatic.
Like testing kids that have, I mean,
Remembering that 45% of the people who have it
Especially in that
are
age bracket.
asymptomatic.
And the other thing that we haven't talked about is contact tracing. I mean, that's really one of the public health mandates is contact tracing. And that does get done by the health department. So, yeah, so I think that that's also another important factor. Dr. Miller?
Yeah, I just wanted to clarify, are we in this amended recommendation or proposal by Dr. Renfro, can we also specify in there, because there was a lot of comments about what the general recommendations are, just to clarify that this is in addition to the state recommendations and the different Department of Education recommendations of social distancing and mask wearing by the teachers and all this sort of stuff, that in addition to those recommendations, we're also adding. I just think that ought to be clarified in whatever the most.
So like in the preamble of it, that
correct.
We're recommending below is in addition to every initial that they've said tonight. And I hope you've got that, Tara. Okay, good, because there were lots of initials flying. And so that will be at the beginning of that's the preamble. Okay.
Yeah, this is Dr. Leidy. I would like to see more of a full document that we're looking at. It's a recommendation, whether it's a recommendation to mandate, it's very spelled out from this board going to the superintendents of schools. This is what we obviously are going to agree with the state thing, but it's good to reiterate that, including the mask wearing, including social distancing, just more of a document. And oh, by the way, these other things about testing also.
Okay. So
versus this little snapshot that we have, right?
Mask wearing, contact tracing, and social distancing. Those.
washing.
Pardon?
Hand washing.
Hand washing. Yeah. So that's a preamble, but that I think can be written outside of. We're not making that we're not mandating something. That's a preamble, and I think the preamble would have to be written at some point. But I think the mandates we could vote on tonight. Yes.
Yeah, Paul. Yeah, but how you guys you're gonna do this for Grant County, but what about all these kids coming into the county playing sports? And they say, no, we're not doing anything.
We are tasked with Grant County, students in Grant County. We are not tasked with everybody else. So we are tasked, our Indiana Department of Health has tasked us with Grant County. So we really can't worry about what the other ones are doing. This is for what the Grant County Health Board believes is important for Grant County.
And
okay. I have a question, Susan?
I have a comment.
Okay, you want to come up forward to the mic, please?
The school nurses, the superintendents are all working together to have individual plans, but they're all going to be very similar. So I would suggest we all meet with you rather than recreating a plan that we took from other school corporations around the country and with the people of the health board in Indianapolis and Dr. Fox. we talked about distancing, we talked about masks, we talked about all the things that you're all talking about. And I think, I mean, I talked to Krista Gagel from Mrs. Sinowat today. I mean, we are all trying to work together. So don't recreate the whole thing, and we can all work together and make it.
But I'm not sure if you did any testing.
Testing was not included. That's
Right,
the only.
so
But
that's really what we're focusing on now is the testing.
right, but you talked about masks and hand
Right,
washing.
that's the preamble, whatever all these other companies have said.
Okay.
They're, you know, and the school board has decided as well about masks and everything. That doesn't seem to, that's not part of this document. It really the testing, this is more testing.
I have a question back to you. When you said that we're all working together, how similar do you think the schools corporations will be in their own recommendations, in their own mandates that they're doing within themselves?
I think they'll be very similar because the guidelines are spelled out pretty closely in a lot of areas. I think we'll be very similar in our discussions at that time. They have to be, I think, if we're all going to live in the same county and share each other's terms.
So, except I understand that the school buildings are different, so
Right.
you're all having to scramble and appreciate what's happening in that. And that's certainly not our area at all. But I do like what you said, if we could read over and basically, as you said, echo what already recommendations from the CDC, education and such, that would be helpful.
So what do you suggest? What does that mean, Dr. Riley?
It means I would like to see what they have.
Before the decision is made?
Yes, for me.
So just a moment.
But I do think that I think we're leaning towards something here unless we see something different.
Sarah, what's our time frame?
I think it just needs to be timely for everyone. We did assure most of the athletic directors that we did have some information for them tomorrow before the close of business.
Yeah. And I mean, they are actually waiting on the health department to come up with something. So kicking it down another week would be more difficult. Doable
For athletic directors.
for athletic directors. And since level 1 pertains to the staff, and we know that from hearing from the superintendent, the staff haven't thought about they haven't thought about testing staff. And they haven't thought about testing athletes. So those are kind of new things that's not incorporated into a 5 yet. Right?
Yes, I would say that too. I mean, we probably thought about it, but we haven't worked on it to the level that Moore has.
Perhaps, and again, Dr. Pearson speaking here, perhaps it would be easier to understand if we could, as a board, lay out a little bit what the logistics of testing would look like. For example, Dr. Moore shared with me some information about a simple nasal test, super simple, easy to do, non-invasive, would not be expensive, I can't imagine, to anyone, the performance of that test. We could share information about locations, timing, the time it takes to do a test per individual, what kind of paperwork's involved. I mean, those are all things that I'm sure you're looking at thinking, my God, this is a horrible nightmare. How can we possibly do it? Maybe we as a board can simplify the idea of that process for you so that it seems more palatable.
Right. And while that's important, that's procedural, and we haven't, I mean, we're not there because they haven't done a mandate. We don't know if it's even going to be necessary to do that. So I think it's important to, if we got to make a decision or we vote it down, we can vote it up or vote it down. But I do, yes, Dr. Moore?
Procedurally, we have looked at this. Optum is available, and we have, as a county, worked with them, and whatever challenge, whatever we've asked of them in terms of testing, Optum has been able to deliver for us. It's been 100 or 150 people and not 400 or 500, but they have expanded their staff. with enough notice to be able to do that. In terms of what Chuck was saying, Mr. Pulley was saying, what do you do when they're gone out? If we talked about the trigger, that if we find that there are kids who, by testing or other means, that have played sports with other schools are infected, we test them. But our idea is, like Dr. Renfro said, let's keep an eye on the horses that are trying to get out, make sure that we close the board and be able to do that. But we have looked at those procedures. That's not the role of the board, but we have, as a department, looked at those procedures and feel that the things that we're proposing are, from a physical point of view, doable. The thing that can be done logistically, it may be challenging for the schools, but you're doing a lot of challenging things getting ready for the year. Parents, do they buy into this? And if we say, as a health board, we're going to let you decide what you want to do one way. We're going to say, as a health board, this is what we see in the midst of a pandemic that we would recommend. And while I say that with strength and energy, I am willing to work to come together with a thing that we all can walk out saying, this may be challenging, may be hard to do. If the burden is on us, but we feel like that we want to do this and that we'll try. And that with each of these, with this brand new thing, if we try something and we learn that it doesn't work, or we learn that we don't need it, that we're not stuck with it for forever. That we're flexible enough to know that this is a very changing scenario. And if we find that the pandemic is running wild, or that we in this county we've tested and we don't have COVID here, we adjust these recommendations based on the reality that we find on the ground.
Okay, so my recommendation is that we take each level and vote on each level at a time and not the whole document. I think there's enough conversation here and figuring of opinions. I think it's easier to go by level one. Then go, we've suggested it be mandate, but we haven't voted on that yet, to be a mandate. And if we say it's a mandate, we could do two votes, one to say it's a mandate and one to see if it's going to pass or not. So the motion is for it to be a mandate. That's vote number one. And I suggest we will do that. So having a motion to make this level one a mandate, we're not voting that we're actually going to do it yet, but we're voting that this would be a mandate. And then when that's done, I'd entertain a motion for it to be that it would be a mandate and we would pass the mandate. So that there's two different votes. So
there's an amendment and then there's a vote.
Right. So the amendment to make this level one a mandate. All in favor say aye.
Aye.
Opposed? Abstentions? Okay, so that would be the other amendment was to make level two a mandate. Had a motion and a second, and so all in favor of level two being a mandate, say aye.
Aye.
Opposed?
Aye.
My call. I vote.
Yeah, okay, let's call for,
Go hand. What do you want, a roll call?
roll call.
I would say aye.
No.
Aye.
Aye.
No.
Dr. Miller?
Aye.
Okay, that's a majority, so that passes as a mandate as well. Okay. So we've got those two looked at, and now we're going to vote actually for, and I'm going to break it apart again, because there's enough voting, there's enough. So level one is going to be read as at least 3 weeks before the beginning of the school, testing for the presence of COVID virus of all school personnel, paid or volunteer. And that's as a mandate. Before you, as I need a motion to vote that we institute this and a second vote. That's what.
So with the amendment, that would be included in it. We don't need
Well, we're not
another.
going to vote on the whole document.
Okay,
I think if we vote on the whole 4 levels, so I'm breaking it down as 4 different
Okay, all
levels.
right. I'll so move.
So move that we vote on this one. Is there a second?
Second.
Okay. So there's a motion and a second, and we're just voting on level one, a mandate, at least 3 weeks before the beginning of school, testing for the presence of COVID virus of all school personnel, paid or volunteer. That's the mandate. All in favor say aye.
Aye.
Opposed? Okay, so for level one passes as a mandate that all school personnel in the county schools would be, that's a mandate. Okay? Level,
One comment, again, when we early on, is that Dr. Moore, again, this is the legal counsel. I want to make sure we're doing things properly.
so it's a legal matter. Okay, level two, students by nature of their activities are at increased risk of contracting the spreading of the virus and tested prior to the beginning of school. The two high-risk groups were athletics and performing arts. That was voted on as a mandate, to be a mandate, but it hasn't yet been voted on with that, with the amendment of the mandate.
And with the understanding that Dr. Bragg is saying that some of them may be doing some activities before school starts.
But it's the way it's written before school starts.
Right.
So whatever.
So I so moved.
Move, is there a second for this? Okay, there's a motion and a second to approve level two as a mandate before school starts, testing for athletics and performing arts students. All in favor say aye.
Aye.
Opposed? I think we're gonna do a roll call on that one.
Let's say aye. Aye.
So what is it?
No.
Okay, an aye and a no?
Aye.
No.
Dr. Willer
Aye.
is an aye, so what
So it passes.
passes? Okay, level three and level four, what would you like to do with that as a group?
Do you still want to take them individually?
Yes.
All right, then I'll make a motion to level three be a recommendation that all students 12 and older be tested 3 weeks prior to the beginning of the school year.
So as a recommendation.
Recommendation.
So this is going to be a recommendation.
Second.
There's a second.
And the word is at least 3 weeks, so that we don't
Prior,
just
yeah, 3 weeks prior.
run them through.
So there's a motion and a second. Any discussion on this? Yes.
I would recommend that perhaps the paragraph that's at the second paragraph of level four also be added to level three, which is the paragraph that says those who would have difficulty tolerating collection by a healthcare professional can have it collected by family members.
Thank you for that clarification. We're actually only voting on the first sentence because that's procedure. That they can't tolerate it, so we're not doing procedural. We're just saying
This is the policy we
this is
recommend.
the policy that we're writing. We're recommending all students 12 and older be tested 3 weeks prior to the beginning of the school year. Sarah, do you have that? Is that clear? Okay. There's a motion and a second. Any discussion? Hearing no discussion. Now we're voting on to make it a recommendation. We're adding the word recommendation. We're not actually voting on the thing as a whole, that sentence as a whole. We're voting on the amendment to make it a recommendation. All in favor say aye.
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 Opposed or abstentions? Okay, so that passes that recommendation. So let's continue on and now, so we've added recommendation. Now we're actually going to make somebody can make a motion that this is now in this is all actually the policy.
So moved.
Okay, Dr. Renfro's on a roll there. He's going to recommend this with the recommendation. Is there a second?
Second.
So what we're voting on now is that this will become a recommendation policy statement. All students 12 and older be tested, recommended that all students 12 and older be tested 3 weeks prior to the beginning of the school year. All in favor? Opposed? Abstentions? Okay. So that's a recommendation. Level 4, and when I read that, that kind of looks like level 3 to me. Yeah, this is all students. So now we're really talking about elementary, younger, under 12. Okay. So do we want to say that, or all students? Because we've said all students 12 and older, all students grade 1. Are we talking kindergarten? Are we talking preschool? What are we talking?
I think as we get down lower and lower, it becomes more difficult to do. So that I would say kindergarten.
Kindergarten? Kindergarten? All students kindergarten and above
12 years.
to 12. Would that make it 12? Yeah, K through 12 years.
Well, one's grade level, the other age.
Yeah, yeah. So how do we want that? Grade 4 to grade 4 to 12, and what would it be?
It's easy if you just stick with an age. Most kindergarten people only age 5. Yes.
Okay.
So age 5 to 12.
5 to 12. Okay. So students age 5 to 12 be tested at least 3 weeks prior to the beginning of school. Is that what the motion would be?
A recommendation.
As a recommendation. The recommendation is students ages 5 to 12 be tested at least 3 weeks prior to the beginning of school.
Sue Nicholson, I think, wanting to make.
Yeah.
When the state has immunizations, it's by grade, because you can have a 6-year-old kindergartner, or you could have a 9-year-old preschool person. So if you mix in ages, it becomes more difficult. So all the state immunization requirements are per grade, except for meningitis.
So maybe we should revisit the level 3 as just saying K through 12.
Just make it one recommendation for everyone? Yes. So if anybody in the school grades K through 12 as a recommendation, they all
So who made the motion and seconded on level 3?
Oh, it's me.
Okay, it was you. So would you like to we have to go back and
Okay.
see that if it's, we have to revisit it to see that if you would approve K through 12 at level 3.
Yes, I would support revising this as a recommendation for all students K through 12.
Okay, 3 weeks prior. And who was the second on that one? Or do you accept that second?
Yes.
Okay. So we now have it as level 3, K through 12, all students K through 12 to be tested 3 weeks prior to the beginning of the school year. That's a recommendation. So since they did the motion, and there was unanimous vote, I believe, on that one, was very unanimous, we will accept that and we will.
But you may want to vote on that, since we changed, that's a significant language,
Okay.
to make sure everybody is agreed.
Okay, we will do a vote on that. Any other discussion on the K through 12 on level 3? Hearing no discussion, all in favor. Now, we're doing the amendment. We're changing it, so we're doing the amendment. All students K through 12 be tested 3 weeks prior as a recommendation. All in favor say aye.
Aye.
Opposed? Abstentions? Okay, so that amendment is carried. So the next step would be to the actual vote for that it reads the recommendation for K through 12 tested 3 weeks prior.
I'll move it again. Second.
So we got the team going here. Thank you very much. Okay, so we have a motion and a second. Any discussion? Hearing no discussion, all in favor of the motion to recommend all students K through 12 be tested 3 weeks prior to the beginning of the year, say aye.
Aye.
Opposed? Abstention? So that passes. Level 4 seems to be taken out of. Correct. So that one can be dropped. So we've made 3 motions and passed through mandate and recommendation. Any other business to come before the committee? Or the council, excuse me? Hearing, yes.
Is it possible that a member or somebody on this board could sit in on the rest of the discussion that goes on with the superintendents? Because again, if
I would be willing also, but the board may want.
because that would be helpful, that if we have to revisit something and change something, logistically, if it's just not, we are able to bend a little bit, but we can only do that if we have open communication between now and August, and we know it's gonna change. But this is at least something going forward. Is that reasonable? Well, I don't know who organizes the superintendents or who might be doing that, but at least Dr. Moore should probably be involved in this discussion. I would highly recommend that anyway.
And as a final, I would highly recommend that they keep the mask and social distancing as highly, 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 highly recommended, and that they all of the adults of the group play fairly and do it.
Lead by example.
And lead by example. Not easy, but we need to lead by example. So, and I would encourage the board and all of the school superintendents to do that. Any other final comments or thoughts? If there's no other business, I declare the meeting adjourned.
Thank you all for all your time and effort on this. I appreciate it.
I thank you for being on, Al.
Thank you.
Thank you for your participation very much. Thank you.
Thank you, Dr. Urban, for keeping me in line in terms of Robert's order.